80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA, devised by Pfizer and Moderna, has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus, in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And this is in the peer-reviewed literature. This is not misinformation.
How can we trust an mRNA COVID vaccine that's been linked to blood clots? This is a question that has been on the minds of many since the pandemic began. Enter Dr. Peter McCullough, a renowned cardiologist who took the stand in the U.S. Senate, presenting a shocking claim. The mRNA COVID vaccines were never safe to begin with. In a time when politicians, bureaucrats, and big pharma were advocating for compliance, Dr. McCullough chose to stand his ground, refusing to take the shot. This, at a time when almost 80% of Americans were being pressured into vaccination. His revelations, however, were not just controversial, but alarming, and they concern anyone who values truth, transparency, and medical freedom. According to Dr. McCullough, the vaccines were fundamentally flawed by design. He explained that the mRNA in the vaccines was chemically altered to resist natural breakdown in the body, which means it doesn't just disappear after doing its job. Instead, it continues instructing cells to produce spike protein, a process he argues violates basic principles of medical safety. There was no long-term data, no off switch, and yet mandates were imposed anyway. Dr. McCullough claimed that the spike protein does not stay put. He said that vaccine mRNA and spike protein have been found in major organs, including the heart and brain, in people who died after vaccination. He even pointed to studies suggesting that spike protein circulates in the blood for 6 to 9 months and increases again with boosters. As a cardiologist, Dr. McCullough's attention was drawn particularly towards myocarditis. Prior to the pandemic, he had only seen 2 cases, but after the vaccine rollout, he examined thousands. He referenced peer-reviewed reports and autopsies, including teenagers, where myocarditis was allegedly linked to the vaccine. His position was clear: even a few confirmed deaths should have stopped everything, but instead, officials doubled down. Dr. McCullough pointed to VAERS data showing tens of thousands of deaths reported after vaccination. He argued that the system massively underreports harm and that injured Americans were dismissed, silenced, or told it was all in their heads. While narratives were being protected in Washington, families were left to suffer alone. Dr. McCullough rejected the claim that COVID vaccines saved millions of lives. He attributed the declining deaths to natural immunity, early treatment, and a weaker virus, not government mandates or experimental shots. This was not about science. It was about control, compliance, and censorship. You don't have to agree with him, but you should know what was said and why it still matters. Freedom begins with the truth. If you believe Americans deserve honest answers, hit the like button, share this video, and subscribe to our channel. Don't let this conversation be buried.
Our first witness is Dr. Peter McCullough. Dr. McCullough is an internist, cardiologist, and epidemiologist from Dallas, Texas. He is broadly published with over 700 citations in the National Library of Medicine. He has testified multiple times in the U.S. Senate, U.S. House of Representatives, European Parliament, and many state capitals concerning public health policy. Dr. McCullough.
Chairman Johnson, Ranking Member Blumenthal, subcommittee members, it's an honor to present my insights, my analysis, my clinical experience on this very important topic. The first time I testified at Homeland Security and Governmental Affairs, before a word came out of my mouth, Minority Senator Gary Peters said, what America was about to hear was misinformation. I didn't even know what he was talking about. I had never heard that term before in academic medicine or in important deliberations. That's November 19th, 2020. What was he doing? He was using an old communist propaganda technique. He was attempting to gain leverage over me before a word ever came out of my mouth. We should never have our public servants ever try to gain leverage over anyone who is coming to Washington to help the nation on an important issue. As introduced, I'm an internist, I'm a cardiologist. I believe I'm the most published individual who's ever testified on matters related to COVID-19 in any of these hearings. I've seen and examined more patients. I've examined more data, and I'm one of the most published people on the topic in the world. And as a cardiologist, I can tell you, my role in this was to fight disease, preserve life, and above all, do no harm. Do no harm. Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem. There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues, New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection is ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Say, Dr. McCullough, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man. Just a few days after Pfizer, he comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart. It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine that's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology. 2 boys, aged 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified. They request an autopsy. They call in University of Michigan and University of Minnesota to look over what are they finding at autopsy. Conclusion, it's Pfizer COVID-19 vaccine myocarditis, unequivocal. These are autopsy-confirmed cases. So for all the mothers in the room, how would they feel if they found their children dead after taking a COVID-19 vaccine?